The benefits of a headache diary. How a headache diary can help with diagnosis and therapy. If the skull hums every now and then, it is usually easy to bear. But many people claim that they regularly suffer from headaches, especially migraines or tension headaches. In this case, experts recommend keeping a so-called headache diary. You find a link in the description below to a recommended headache diary. With the help of information about the duration and intensity of the pain, medication intake, stress in everyday life and accompanying symptoms, it is usually easy to diagnose the exact type of headache. It is therefore advisable to bring the headache diary with you to the doctor's appointment. But this is not only an important tool for diagnosis. The headache diary also helps to identify triggers such as neck and/or shoulder tension for the complaints. Especially with migraines, patients report typical, so-called trigger factors. Stress is mentioned particularly often. But hormones, certain weather conditions or food therefore often trigger attacks. Are your complaints already being treated? You can then use the headache diary to track how well the treatment and medication are working. It is best to discuss your protocol regularly with your doctor. Headache diary for chronic complaints. Anyone who is chronically affected by tension headaches or migraines usually can no longer cope with everyday life as usual. According to the definition, this is the case when complaints occur on more than 15 days per month, over a period of more than 3 months. It is then very important for those affected to keep a headache diary, because this can be necessary for proceedings under social law. For example, for the application for reduced employment or disability pension. Ask your doctor what information should be included in your headache diary for such purposes. Headache diary for children. According to the DMKG, German Migraine and Headache Society, headaches are increasing in children. A study of almost 7,000 schoolchildren shows that around 90% of children experience headaches by the age of 12 to 60% of them have tension headaches and up to 12% suffer from migraines. If the symptoms recur, even the little patients should keep a headache diary. Parents can help and get a child-friendly copy from the doctor. This usually contains clear drawings and simple questions about how the day and the mood were. At your next appointment with the doctor, ask about the children's headache diary.